Tim, thank you. It's 6:32 now. A 5-year-old girl tested positive for the coronavirus in Maryland, and the number of cases keeps growing in our state. Governor Larry Hogan now takes more steps to stop the spread. Right now, there are 107 confirmed coronavirus cases in Maryland. WJZ has team coverage, and we start with WJZ investigator Mike Helgren.
Some people are treating this like a vacation or a spring break.
Governor Larry Hogan says because people did not listen to warnings to stay apart, he's signing executive orders adding restrictions, including temporarily shutting down enclosed shopping malls, restricting travel on mass transit, and making the terminal at BWI Marshall Airport only open to ticketed passengers, airport workers, and those assisting the disabled.
Let me be very clear. If you are engaged in this type of activity, you are in violation of state law, and you are endangering the lives of your fellow Marylanders.
Greater Baltimore Medical Center in Towson says 2 patients were seen in their emergency department before being discharged.
The worst thing that could happen is if not very sick patients brought the virus to the hospital and infected the staff.
The governor also revealed the first child in Maryland contracted COVID-19, a 5-year-old from Howard County.
It saddens me greatly to know that this pandemic has now hit this close to home. We can confirm that the child is a Howard County Public School System student attending Elk Ridge Elementary School.
The child was evaluated and sent home to recuperate. Given the time frame of onset, the child was not an exposure risk to children and staff at school.
Maryland also recorded its first death, a man in his 60s from Prince George's County who was the first in the state to get the illness from community spread. 9 firefighters who came into contact with him remain quarantined.
I know that all Marylanders joined me in praying for his family and his loved ones.
Mike Helgren, WJZ.
Also new this morning, the University of Maryland Medical System announces big changes to its visitor policy. No visitors are allowed except under specific circumstances and with prior approval from a doctor. This policy applies to all patients within UMMS hospitals. This new rule goes into effect today at 3 p.m.
6:35 now. First it was bars and restaurants. Now it is malls and entertainment venues closed to stop the spread of coronavirus. Our team coverage continues this morning with Amy Kawada. She is in Towson with more on how these changes are impacting the area. Amy.
Good morning, Tim. Well, the majority of people tell us they agree with the governor's decision to close down places like here at Towson Town Center, which typically attracts large crowds of people into somewhat of a confined space.
Thursday afternoon, Governor Larry Hogan's latest concern, eliminating large gatherings and limiting the number of people together at a given time.
Today we have amended our previous executive order to prohibit any events of more than 10 people in close proximity.
That means shopping malls and entertainment areas are no longer able to operate. Lexington Market and Baltimore Public Markets also announced their closures.
It's really scary for somebody my age.
Sylvia Smith-Johnson says she feels for the employees now out of a job, but believes this to be the right decision.
It's really scary to go into any kind of enclosed setting.
Many retail stores within strip malls are voluntarily modifying store hours or shutting down altogether in an effort to limit large groups.
Even if we don't get it or we don't get super sick from it, other people can.
And some of the restaurants behind me here are still offering takeout and delivery services, but again, all gatherings of 10 or more people here in Maryland are now banned. Reporting live this morning in Towson, I'm Amy Kawada for WJZ.
Governor Larry Hogan urges residents to use mass transit for essential travel only. Our team coverage continues. WJZ is live at the Mondawmin Transit Station with Mike Hsu reporting on this impact. Mike?
Good morning, Lynn. Well, it's a bit of a paradox. You know, social distancing is important, but it's almost impossible to happen on some of these buses. But people need the buses to get to work.
Chains have been installed on MTA buses to block anyone from sitting near the drivers, and that means
you just can't get on the front of the bus. You have to go in through the back door.
Luckily, on this run, there were only a few passengers.
The bus was practically empty.
Business closures and working from home mean that schedules are being cut back.
I put my mask on, my gloves.
Tierra Little got off the metro at the State Center near downtown.
And I stay as far away from people.
She wore a mask and gave out hand sanitizer to fellow passengers.
It wasn't too crowded today. Yesterday it was pretty crowded, yeah. Really? Yeah, super crowded. No seats. Everybody standing up close together. I actually let that train go. I didn't get on it.
The governor implored people to only take mass transit if the trip is essential.
We've made some further announcements about trying to keep people off of all of our transit systems and the metro if they're not essential workers and if it's not really important that they travel.
But for many, like this bus passenger, she still needs to get to work.
I have to go to work. I have no other option.
So the state defines essential travel as going to the doctor, the pharmacy, the bank, the grocery, or work. I'm Mike Hsu reporting live at the Mandama Metro Center for WJZ.
Thank you, Mike. It is 6:38 now. The death toll from the coronavirus in the U.S. has topped 200 and more than 14,000 people are now infected. Cindy Palm reports for WJZ. Last night, California took the most drastic measure to date to try to slow the spread.
California Governor Gavin Newsom has ordered nearly all of the state's 40 million residents to stay at home indefinitely. That's about 1 in 8 Americans.
We need to bend the curve in the state of California. And in order to do that, we need to recognize the reality.
It comes as the number of people infected with the coronavirus throughout the U.S. continues to rise.
If we can slow the spread, we can buy days. And when we buy those days, that means that we can get ventilators, and we can get beds, and kits, and masks, and tests, and this will save lives.
On the other side of the country, New York Governor Andrew Cuomo put in new restrictions for all non-essential businesses.
That means 75% of the workforce must stay at home.
While Pennsylvania is shutting down non-life-saving businesses, hundreds of contract workers at Philadelphia International Airport have already been laid off. Herbert Stewart fears he's next.
I'm a father of 6, 4 boys, 2 girls, so this is going to hit me dramatically.
In Washington, D.C., Republicans and Democrats start negotiations today on a stimulus package to help American workers and businesses.
Corporations should not get a bailout and then be allowed to fire employees or cut their salaries.
The Republican proposal gives every American up to $1,200.
Money for people, from the middle class on down, period.
Globally, the head of the United Nations is calling for a coordinated response.
If we let the virus spread like wildfire, especially in the most vulnerable regions of the world, it would kill millions of people.
Yesterday, the death toll in Italy surpassed the total in China. Cindy Palm, CBS News.
Governor Hogan and other governors want the 2020 census delayed. You may have already gotten the information you need in the mail. This year, you can do it by phone, mail, or online. It is important to participate, and also you could be fined if you don't do it. But your answers affect funding for the communities, and that's something really needed during times like this.
The uncertainty of the coronavirus pandemic is causing many of us to feel a bit stressed or anxious. Kelsey Kushner explains what doctors say you should do every day to help keep your sound state of mind.
We've heard it over and over. Wash your hands, stand 6 feet apart, and stay inside to stop the spread of the coronavirus.
It's crushing.
But the many rules and restrictions we now have to follow can lead to overwhelming anxiety in many of us.
They're afraid. You know, it's a scary time. But we're also trying to limit where the fear doesn't paralyze.
The fear is felt worldwide in the United States, and here in Maryland, airports are deserted, gyms locked up, bars and restaurants switching to carry out only, and grocery store shelves left bare.
I've been working from home, so I think just staying occupied really helps.
It's a new normal that's not easy to cope with. Doctors say the key is to find balance and get into a routine.
Just because we're home and you have all the time in your hands, you want to have structure. Get up in the morning, and even if you can, don't just be in your nightgown all day long.
Dr. Jemima Cancan with MedStar Harbor Hospital says turn off the TV and instead pick up a book, go for a walk, exercise, or call loved ones.
We try to get people off electronics, play games, play board games, play cards, right? Try to get away from the media because it is a little much.
And if you feel alone, remember, we're all in this together. Kelsey Kushner reporting for WJZ.
And stay with us as we follow the newest developments in the coronavirus pandemic, both here and across the country. We have everything you need to know posted online at WJZ.com.